Missouri parents are facing unprecedented challenges in protecting their children's well-being. Today, we'll examine the urgent need for common-sense legislative reform in our state, backed by data, expert testimony, and international precedent. Studies indicate a dramatic rise in gender dysphoria cases, particularly in progressive political jurisdictions. This isn't happening in isolation. It's part of a broader pattern affecting schools across Missouri. In January 2022, a Parkway School District counselor reached out to Washington University seeking guidance about elementary school girls requesting chest binders. The counselor noted, "We are seeing an increase in students wanting to use chest binders." Washington University advised the district not to notify parents. This practice of withholding critical information from parents has become commonplace in St. Louis County Public Schools. A recent study titled Increases in Self-Identifying as Transgender Among U.S. Adults 2014 to 2022 concluded that more people self-identify as transgender than in previous generations, with young people driving this change. Jamie Reed, a former employee at a St. Louis gender clinic, came forward in January 2023 with shocking revelations. Writing in the Free Press, she stated, "There are more than 100 pediatric gender clinics across the U.S. I worked at one. What's happening to children is morally and medically appalling." Reed documented how the patient population dramatically shifted. Before 2015, cases were rare. Then came a sudden increase in teenage girls with no previous history of gender distress, demanding immediate treatment. When Reed started, there were about 10 calls per month. When she left, there were 50, with 70% being girls. The international medical community is responding to these concerns. Countries once considered leaders in gender-affirming care, the United Kingdom, Sweden, and Finland, have shifted course due to safety concerns and lack of evidence. The 2023 CAST review in the UK concluded that the scientific basis for using puberty blockers and hormones in minors was weak. The Tavistock Clinic in London was subsequently shut down by the UK's National Health Service. Sweden, Finland, Norway, France, and Denmark have all categorized youth transition care as experimental and significantly limited its availability, recommending mental health support as the first line of treatment. In Missouri, the SAFE Act was signed by Governor Mike Parson on June 7, 2023. While the surgery ban for minors is permanent, the ban on puberty blockers and hormone therapy is set to expire on August 28, 2027. Nationally, 27 states have enacted similar restrictions, while 18 states have passed shield laws protecting access. The June 2025 Supreme Court decision in U.S. v. Scrimeti upheld Tennessee's ban, clearing the way for similar laws in other states. Parents across the political spectrum want transparency. In a survey of the progressive Kirkwood School District, 60% of respondents said yes when asked, should school district employees be required to notify parents if they learn their child is considering changing or has changed their gender, pronouns, or preferred name at school? This isn't about politics. It's about fundamental parental rights and child safety. Looking ahead to the 2026 Missouri legislative session, two urgent priorities emerge. First, make the prohibition on transgender drugs and procedures for minors permanent. Second, require school personnel to inform parents when their child is undergoing or considering gender transition. Missouri's children deserve protection. Missouri's parents deserve transparency. The time for common sense legislative reform is now.